So now we're going to talk about the Settegast method of getting a tangential view of the patella. Typically we take what's called a sunrise view of the patella, and then in which case they are on their back and we have them hold a plate. Sometimes you're limited with patient condition. Sometimes they don't feel like they can do that and hold the plate and do different things. So this is what I say, like an easier way to still get the same view, and I feel like it's easier for the patient. It's a little bit more work for us, but it's safer for the patient, and a lot of times, again, their patient condition, they're just not able to do the other view. So it's called the Settegast method. There are actually two, but we're going to cover one for right now. Same principle as before. Keep the body part of interest in the middle of the cassette. Again, it's going to help with your penetration and your dose and calculations and things like that. So the patient is laying on their belly or prone, and what you do is you bring the leg to 90 degrees, okay? If your patient is totally comfortable to hold this position, then they can do that. The problem with that is sometimes they think they're holding it, but you start to kind of see this little sway motion, and motion in x-ray is not good. So if you see that when they have their leg up here, you see that they're kind of rocking back and forth, it's very easy to solve, in which, I say easy, can you bring your arms back for me? Give them a sheet or something, wrap it up on the ankle, and have them hold it just like that. And again, be sure, that's going to make sure that it stops, it doesn't go anywhere, but you want to make sure you don't over flex the knee. You want it at a 90-degree angle. Okay, so to do this x-ray, again, you have to, let me back one from the left, go at a 15 to 20 degree angle to the body part of interest, and always keeping in mind that you are 40 inches away for your what's called SID, okay? And we are at about 30, there we go, we are at 40. Okay, so you would ask your patient to hold nice and still. Again, you're trying to feel that patella, feel that apex of the patella, and go right, put the crosshairs right distal 1/2 inch to that patella, okay? Now, collimation for this is much more difficult. Let me check my angle here. Too much angle there. Okay. So as you can see, it's almost coming right at the leg. Again, it's only 15 to 20 degrees with the patient in a 90-degree flexion. You are going to catch a little bit more of this, the femur and the tib fib itself, but you are going to collimate out a little bit as well. And I can already tell that my tube angle is not appropriate. If you can look at the alignment of the tube itself and the patient, we are way, way, way off. So it's always good to come back, look at your patient, and that is not coming at a straight angle at all, okay? So we're gonna adjust that. Very simple to do. You may have to adjust your angles again, but all in the name of getting a good x-ray. Much better. Okay, now I just need to align this one more time. There we go. Again, I feel like I have way too much angle. There we go. So collimation for this is actually going to be pretty tight. Again, you don't want to go within the shadow margins here, and you're always going to mark to the outside of the patient. So this happens to obviously be her left side, so I'm going to put my marker here, just like that. So what you're going to see is that patella that sits on top of the tib fib and the femur itself, so you're actually getting a view of the patella itself and what's underneath, the articulation between the femur and the tib fib and the patella itself. So this is just one of the 3 methods that you can get a patella view.